Good morning. Today's the topic is about anesthesia for trauma and burns. First, anesthesia for trauma definition. Trauma anesthesia is the administration of anesthesia to patients who have suffered injuries due to accidents, fall, burns, violence, or disaster. Goals of anesthesia in trauma. First, maintain airway and breathing, controlled bleeding and circulation, prevent shock, provide pain relief, maintain oxygen supply to organs, prepare patients for emergency surgery. Next, preoperative assessment. First, airway assessment. In airway assessment, check for facial injury, blood or vomit in airway and neck injury. Second, breathing. In breathing, observe chest movement, oxygen saturation, and the lung injury will be observed. The third one is circulation, pulse and blood pressure, blood loss, IV assess. The fourth one is neurological status. In neurological status, GCS is checked. GCS means Glasgow Coma Scale. Next, the head injury assessment. The fifth one is investigations, which means the blood related tests, HB, blood grouping, X-ray, CT scan, ECG, etc. The next topic is anesthetic management in trauma. First, airway management, endotracheal intubation commonly used, cervical spine protection is very important. In anesthetic management, induction agent is ketamine. It is maintains blood pressure, etomidate, cardiovascular stability. Propofol used carefully due to hypotension. In muscle relaxant, succinate scoring and rocuronium is used. In maintenance of anesthesia, oxygen plus inhalational agent, IV fluids and blood transfusion, monitoring vital signs are continuously. Complication in trauma anesthesia, hypovolemic shock, aspiration, difficult airway, hypothermia, and cardiac arrest is the commonly side effect. The next topic is anesthesia for burns. Definition. Burn anesthesia refers to anesthetic care given to patients with thermal, chemical, electrical, or inhalational burns. Next, problems in burn patients: fluid loss, severe pain, infection risk, airway edema, electrolyte imbalance. The next topic is preoperative assessment in burns. First, we check the airway, facial burns, soothe around the mouth or nose, and inhalation injury. Next, breathing, smoke inhalation or oxygenation assessment. Next, anesthetic management in burn patient. First, fluid resuscitation. In fluid resuscitation, we use the Parkland formula, which means 4 ml into body weight per kg into percentage DBSA burnt. Next, half fluid in first 8 hours and the remaining over next 16 hours. Airway management, early intubation if airway edema suspected and 100% oxygen is given to the patient. Next, drug is used. Ketamine commonly preferred and avoid repeated succinate scoring after 24 hours because due to hyperkalemic risk. Monitoring, ECG, pulse oximeter, urine output and the temperature is checked. Complications in burn anesthesia, shock, sepsis, hypothermia, renal failure, electrolyte imbalance. The next is post-operative care, which means after surgery what to give to the patient. Pain management, oxygen therapy, balance monitoring, infection prevention and the ICU care if severe injury is caused to the patient. Thank you.